Hello, my name is Hannah Baker, and today I'll be discussing an article I found titled Effectiveness of Social Work Intervention with a Systematic Approach to Improve General Health in Opioid Addicts in Addiction Treatment Centers. I chose this topic because it specifically dealt with social work interventions with a systematic approach. Um, just to make note, however, this article did come out in 2016. So I feel like uh, there could be more person-centered language in this article, possibly um, substance users in addiction treatment centers instead of using the word addicts. Um, but that could also just be a showing of the time in 2016 and the language that was being used clinically. Um, but just making sure that I make a note of that as 2016 was 9 years ago, and probably a lot has changed. Um, and I think a newer study looking at how the health has improved in substance use centers, chemical dependency treatment centers, um, has worked. The purpose of the study was to investigate the effect of social work intervention aimed at increasing general health among opioid addicts in addiction treatment centers. Um, Now, as I said before, I wish there was more person-centered language. However, this is verbatim the language that was used in the article, so I'm going to use the language that they used in the article. Um, so yeah, the purpose of the study is using a systematic approach, which I think is interesting, and it was interesting to read about as well. So they stated that this is an experimental plan. Uh, the study sample included 60 patients with drug dependencies undergoing treatment in addiction treatment centers. These patients were randomly assigned a case and control groups as case and control groups. The case group was subjected to intervention over 10 sessions, whereas the control group received no intervention. Both groups then passed through a post-test, while a follow-up was conducted after 4 months. Data was obtained via a general health questionnaire. So looking at this study and the patients and methods that it uses, um, I think using a control group is a good idea, especially uh, because addictions and substance uses can look so different in so many different people. Um, I think that there could have been larger numbers in this case, especially if we're only looking at 30 versus 30 cases. I think that having more information, maybe even like 100 versus 100, would be a good starting off point that could back up more evidence-based and, really vary the information and interventions that do come out over the 10 sessions. I feel like with 30 people, you can get a good idea of information over 10 sessions, or I should say 60 people since they were doing, or no, it was only 30 people that did the sessions, but the control group did not have any sessions. I think their intent was very clear that they wanted to show that the interventions over the 10 sessions would be very helpful. So then maybe using a smaller number in that case would help pinpoint that the fact that, yeah, look at this, like these 30 people got better in CTOP and these 30 didn't. So it's like a 1-to-1 ratio. So the results of the test, they did a covariance analysis test and independent dependency test results of the questionnaires that were given back by both the control group and the study group. And they indicated that a social work intervention adopting a systematic approach was effective, increasing the general health of drug-addicted patients under treatment. It does go into more of the results in the article, and more into the different interventions they used. They specifically focused on motivational interviewing, as well as focusing on interventions that are specifically used in substance use or addiction treatment. Um, and it was interesting to see the interventions that they did choose for the 10. A lot of them were kind of similar and not really interventions that could vary in like the synopsis of the study. I think it was interesting to see that uh, there was nothing happened in the control group, but that's just because none of them got interventions. So it was sad to see that nobody in the control group got better. But with the extra social work intervention, the 30 patients who were struggling were able to increase their general health, which I think was the point of the study, and also a bonus that people were able to get healthy. So according to the article, the researchers faced limitations in this intervention, including a few numbers of studies focusing on the social work intervention and no willingness of the participants to end the study due to addiction problem. Hence, they tried to motivate them to answer the questionnaire and participate in the treatment sessions. So I also chose this journal because I found it a little interesting thinking ethically and thinking about person-centered care, thinking about substance users as individuals and makers of their own life and individual decision makers, especially in the field of study that I've been working in. We work with a lot of like non-judgmental thinking and just observing and seeing what interventions do work. And the interventions that do work are the ones that the individuals also learn something alongside them. And I think that the first step in receiving services has to be that the client or the receiver of the services is a willing participant and is completely informed about what's going on in the study and or the questionnaire, for example. They shouldn't be bribed or motivated to fill out the questionnaire. It should be ethically sourced information. So that does cause a lot of discourse and discussion of like, is this information that we're using, is it ethically obtained? Did the individuals who get better due to the health questionnaire, were they told to answer the health questionnaire positively after participating in the treatment sessions by individuals who they may be working with, maybe case managers or other human services workers? They could, want them to fill out the questionnaire, or they could be involved in the study. And they could also want them to be involved in the study because then they would be doing social work interventions. So there's a lot of nuance there in the situation, and I think that's what made this article stand out to me as interesting. And I'd be interested to see, since this was in 2016, how much that has changed, especially locally here in Minnesota. I think we have a lot of individuals who get really good substance use care here, and I wonder, with the added social work intervention, how that changes things, how that changes group dynamics, maybe at the substance use treatment centers, things like that. The conclusion was pretty straightforward with the study. The nature of the presence of social workers in addiction treatment centers has been effective and can have a significant influence by reducing anxiety, insomnia, somatic or bodily symptoms, improving patients' self-understanding, self-recognition, and enhancing social functioning. I think that is an interesting conclusion based on the information that was taken. I think it's interesting to come up with conclusions with such a small number of the case study, um, especially if you're making claims like reducing anxiety and insomnia with only 30 people. Uh, can you say that all 30 of them suffered with insomnia and anxiety, and then all of them got reduced symptoms? Or was this just one or two people in the 30 who had maybe a reduction in anxiety, insomnia symptoms, just as happened instead of over those 10 weeks of services? Somatic symptoms like bodily symptoms, that could be done by completing trauma work, which I think could be something that social workers could be working with in addiction treatment centers. And also that could be the placebo effect of just being sober for 30 days or over the 10 weeks, I mean, the 30 participants. Was the reduced anxiety, insomnia, and bodily symptoms, was that because of the interaction of the social worker coming in and key interventions, or is that just because people who are struggling with substance use are going into space where they're supported, their mental health is supported, they are given other medications, possibly benzodiazepines, sleep medications, things like that, as PRNs at these treatment centers. So is this, I think that begs the question of my main question of this study and the validity and ethicality of this study. All of their conclusions could be from a different hypothesis that the 30 individuals had a reduction in anxiety, insomnia, somatic symptoms because they were able to become clean after. It doesn't exactly say how the length of substance use. Yeah, this was interesting to read about and kind of play devil's advocate a little bit. Looking at the improving patient self-understanding, self-recognition, enhancing social functioning, I do think that there is something that can be said for the presence of social workers. I think they can do CBT, DBT, any other sort of coping mechanisms or interventions that, or modalities that can help patients self-understanding, self-recognition, and can enhance social functioning. And then there's also the fact that these patients are also clean. So are they understanding themselves better and recognizing themselves better and being able to put themselves out there social functioning because they are in a treatment center, or is it directly involved with the social workers that are working with them? So yeah, this was a interesting study to read about. I think that I would like to know more about why there was such a lack of willing participants. They say that in the limitations, but they don't necessarily say why. And I could, I could hypothesize that that could be due to people maybe not being in the right place to go into a treatment center at this time, or not being all in, maybe just deciding that getting clean sober isn't what they want to do right at this moment. So I can understand that being a willing or non-willingness factor. But I would like to hear more about what everyone else in the cohort thinks. So let me know what you think, and thank you so much and have a good